Hi, Dr. Neal. I hope everything's going well. Um, so just kind of to start off the reflection, I just want to say I'm doing pretty well. I think I've started gaining a little bit more responsibility and the trust of the preceptors a little more. And I guess what I really just mean about that is it was slow at the start, and I think that was simply because they were trying to figure out what we knew, what we didn't know, what we were learning, like obvious things like that. Lately, it's been picking up. I've been increasing taping with people, doing a little bit of ultrasound. I'm not setting it up. Some cupping, a little bit of Graston. Just learned that 2 days ago, technically. So that's still a little new to me, fresh in the in the head. But all in all, going well. Um, I guess one of the things that's bad would be sometimes I feel like I don't know where Connor went, and I guess that's not really bad. Like he comes back, but I've noticed a couple times where I just didn't really know where he went, and it's not that I feel like I'm not being utilized, but when he goes off somewhere and like say I was taping someone, then I kind of don't know where to go off of that. So what I've been doing lately is just going to another preceptor or really anyone in that facility and just seeing if they need any help, if there's anything else going on. Sometimes, they'll actually let me do something like, oh, like go cup him, her patient, whatever needs to be done. Other times it'll be, go get towels. And it is what it is. That I think that's just really the only bad thing I can think of. So don't think too much into that. But the good things, really, I just want to emphasize, like, I've been gaining a lot of knowledge and a lot of responsibility. We implemented the Fatty PRO last week, and tomorrow, I believe, will be a week since we used it first on one of our girls. So that'll kind of be like that follow-up. And the only thing that is kind of difficult about that is the time, because not all of them come in for treatment per se. And the girl that we used it on, she's back to practice. So I'm not too sure if we missed that window there. I think regardless, I should get that measurement just to be like, well, she's officially returned to play. This is what she's at now. So then if something happens again, we can still use that to compare later. But sorry, kind of got a little off track there. Um, I think one of the actionable things that I can start doing to ensure that I'm staying active and not just sitting around in a sense is really just inserting myself into situations. So making sure that I'm respecting boundaries, but if someone's doing something I didn't know or haven't learned about, like dry needling, I've been seeing a lot of locations in that, and I haven't really asked too many questions. I could probably start doing that more. I know some of the basics, like return clockwise, get the inflammatory response, all that kind of stuff. But there's definitely more information that I can be learning, and I really just need to like get myself into that setting. And then I guess kind of off of that is more along the lines of me continually improving on the skills that I already know. So for an ankle tape, for example, I used that for one of my proficiencies, and Connor gave me the highest ranking. But I know that there's a lot more work for me to do, and sometimes maybe when there's downtime, I should really be trying to like get someone to let me tape, or just keep practicing, have someone show me something else. And the only issue with that is sometimes it's hard with their time because they'll use that to document things, kind of along those lines. Um, but all in all, with the clinical so far, I've gained responsibility. I'm having a good time. And I really just think at times I need to insert myself more just to make sure I'm getting the most out of this experience. And other than that, I mean, things are going really well. So I, I hope things are going well on your end too. Bye.